My name is Dr. Cliodhna O'Donovan, Chartered Psychologist of the Psychological Society of Ireland, and today I'm going to talk to you very briefly about discussing the coronavirus, otherwise known as COVID-19, with adults with intellectual disability or other vulnerable adults. Let me start by saying it's vital that adults with intellectual disability and other vulnerable adults are provided with information about the coronavirus and are also afforded the opportunity to discuss any concerns and ask any questions they might have. For every individual, either with or without intellectual disability, the type of information they require and how best to communicate that information is specific to the individuals themselves. I think one of the best places to start is to consider what information the person already has. What do they understand about health and sickness? What do they know about keeping themselves well and keeping others around them well? What do they know about cough etiquette and good hand hygiene, for example? What's their understanding of what would happen if they were to become unwell with COVID-19 or if a loved one were to become unwell? Also, depending on the individual and the context, they may benefit from knowing more information about what would happen if a person were to become unwell and didn't get better. It is vital that we acknowledge what is going on and validate any concerns an individual with intellectual disability may have. Well-intentioned sayings like, "Don't worry, everything is okay," are usually unhelpful, because an individual with intellectual disability is likely to pick up on the concerns and worries of those around them, staff and family members, for example. Also, they're likely to notice significant changes in their own daily routine, such as the closures of day services, not visiting friends and family, activities being cancelled. They may also notice that staff perhaps are wearing personal protective equipment when working with them, like masks or gloves. When adults with intellectual disability are seeing all these significant changes in their daily lives, if they're also being told that there's nothing to worry about, this is likely to be very confusing for them. On the other hand, about 52% of adults with intellectual disability also present with a coexisting mental health problem, and therefore they may be more vulnerable to developing mental health problems in these uncertain times, or they may experience an exacerbation of existing mental health problems. This is also true of adults and others in the general population. Therefore, it is important to tailor the information that the person is receiving to ensure that it is factual and clear and measured. It may also be useful to consider turning off the news at different points throughout the day to moderate the type and the quantity of information the person is receiving. For staff and family of an individual with intellectual disability, they may also consider not discussing the crisis around the individual or in front of them, and this may be very difficult to do because this pandemic is consuming all of us to a certain extent, but it may contribute to symptoms associated with anxiety for the individual. Lastly, as with anything, when any important information is being communicated to anyone, either with or without an intellectual disability, it's essential to ensure their understanding. This can be done in a number of ways, facilitated through the use of simple language, visuals, social stories, easy read documents, to ensure the person is understanding the information being given to them. At all times, consider the level of the person's communication needs when communicating important information about the coronavirus. Thank you for listening, and for more information, please log on to www.psychologicalsociety.ie.